Good morning, everyone. We'll get started in just a moment. We're going to give our panelists and our guests an opportunity to get in and get settled. We have a fantastic morning of experts and quality information to share with you. Thank you so much for coming. Good morning to those who are just joining us. I'm so happy to see you. Come on in, get comfortable. We have a full morning of the State of Black Children in Texas Summit, standing at the crossroads of recovery and resilience. I'm delighted to be here and to share with you information from Children at Risk studies and research over the last year relating to Black children in Texas. And I'm delighted to welcome our partners for this event, including the Texas Racial Collaborative, of which I'm delighted to be a director, the United Way of Greater Houston, Houston Area Urban League, the National Council of 100 Black Women, the Houston Metropolitan Chapter, Dallas Truth, Racial Healing and Transformation, Change Happens, Target Hunger, the Gulf Coast region of Phi Beta Sigma Fraternity Incorporated, the Early Learning Alliance, the Austin Alumni Chapter of Delta Sigma Theta, the San Antonio Alumni Chapter of Delta Sigma Theta, Gulf Coast Apollo Chapter of the Links Incorporated, the Katy Area Alumni Chapter of Delta Sigma Theta, United Way of Tarrant County, YMCA, El Paso del Norte Region, Lone Star State Q's, Texas Spring Cypress Chapter of the Links Incorporated, Head Start of Greater Dallas, and Funky Town Fridge, of course, from Fort Worth. Thank you so much to our partners. As a matter of housekeeping, I want you to feel free to use the chat or the Q&A to interact and pose questions for our featured speakers today. If you're posting on social media about the event, please be sure to tag us at Children at Risk. A lot of this information will be put in the chat for your convenience as well. We are putting the agenda event, the speaker bios, and a link to future events also in the chat. As I introduce our guests today, I will, of course, call their name and their titles and their area of expertise, but we invite you to visit the link for all of their wonderful bios. And of course, your feedback is vital for us to continue improving our events at Children at Risk. So please fill out the survey you will receive at the end of the event. And if I neglected to introduce myself, I'm Sharon Watkins-Jones, Chief Equity Officer at Children at Risk and the Director of the Texas Racial Equity Collaborative. I'd love to introduce to you at this time, Amanda McMillan, who is President and CEO of the United Way of Greater Houston, one of our good dear friends to the organization, and I would like to ask her to provide some opening comments.
Well, thank you so much, Sharon, and good morning, everyone. Again, my name is Amanda McMillan. I'm President and CEO of United Way of Greater Houston. So honored, Sharon, to be here with you today and such incredible community partners across our Lone Star State to open up Children at Risk's State of Black Children in Texas Summit. I thought it would take just a few minutes to highlight the data that drives our mission of working together to improve lives, build a stronger community, and create meaningful opportunities for people to prosper, and how that ties into the work we're doing to reduce inequities that we're all here to discuss this morning. For us, a key data set that really helped us sharpen our focus as we headed into our second century of service is called ALICE. ALICE is an acronym for Asset Limited Income Constrained Employed, and it represents the growing number of families across Texas who are unable to afford the basics of housing, childcare, food, transportation, healthcare, and technology. Some of these things are exactly what we're talking about this morning. And these hardworking households are really often struggling to keep their own households from financial ruin while keeping our own local communities running. We're going to include a link in the chat for this data set so you can see it at unitedforalice.org. But if you look at the statewide data for ALICE, you will see that a disproportionate number of households experiencing ALICE are in BIPOC communities across our state. You'll also see that the cost of living is increasing for ALICE households. You'll see that worker vulnerability is growing while wages stagnate in ALICE jobs. And you'll see that the number of ALICE households is on the rise. And we'll have new ALICE data coming out later this spring statewide that will further illuminate the challenges our neighbors have been facing through COVID-19 and beyond. This data has really been a key driver for our strategic focus at United Way of Greater Houston. And when we look at what we're doing to build a stronger, more equitable community and the specific work we're doing, it really resonates strongly with the key findings you're going to hear about in the State of Inequities report that Sharon's going to be presenting in a few minutes. The work we do every day at United Way, alongside several of you who are joining us this morning, is aimed at helping our neighbors who are experiencing ALICE land on their feet and stay there. A few ways in which we're doing that, just to lift up a couple of the programs that relate directly to the topics we're discussing today. We partner with and invest in 105 nonprofit partners across the community to provide financial stability services, coupled with the critical wraparound services of early childhood and youth development and healthcare programs, because we know that these are key needs that people have to be able to take care of as they navigate their journey to financial stability. We know access to quality, affordable healthcare is critical, which we're talking about today. We have early childhood programming like our United Way Bright Beginnings program, where we provided high quality childhood education programs to over 15,000 children over the last 20 years. We target quality out of school time programming through our Out to Learn partnership, where we're expanding access to quality out of school time programming across our community. And because we know our neighbors have to make sure the basics are taken care of as we work toward a better future, which we're also going to talk about today, we're here to support a safety net of basic needs services, whether that's food or housing assistance or support to help people escape violent situations and many other basic needs. Several of our partners work really hard to cover those basics, and we also connect people to possibility through our 2-in-1 Texas United Way helpline, which connected more than 1.2 million people across Texas with help in 2022. The access to basic needs, quality, affordable healthcare, quality educational opportunities, and justice are the building blocks for our children to experience a more equitable future for Texas. I'm excited about the incredible panelists we have today to discuss each of these vital topics and what each of us can do to move this work forward and create intergenerational change across Texas. The work that Children at Risk and many of you are doing to lift up the root causes of child poverty and inequality are absolutely critical to the future of our state. And I'm grateful for and inspired by what we can do together to fulfill the promise of a brighter and more equitable future for Texas. Thank you.
Thank you so much, Amanda. We're so grateful for your partnership, and we're looking forward to continuing to work with you for Texas children. Thank you so much. I'd now like to take a little bit of a dive into the data of our 2023 Equity Report, State of Inequity, Dreams Deferred. Our report is divided into categories, the first of which is access to good health. And we know that Texas ranks in the bottom quarter of states when it comes to both access to and quality of care for Black and Latinx populations. Families and children of color are more likely to suffer worse outcomes from treatment than white families in Texas, according to the Commonwealth Fund study. While rates of anxiety, depression, suicidal ideation are increasing for people of all races and ethnicities, we find in our review of these studies that there are notable differences across the races. Black youth have had the highest average percent increase over time for suicide. The State of Inequity, Dreams Deferred examines health inequities in immunizations, maternal mortality, mental health, and healthcare in the borderlands. And we will delve into those in detail with our guest. We will also take a look at basic needs. The report rolls out data that tells us that children children cannot learn or thrive when their basic needs are lacking, such as food and shelter. In Texas, the likelihood of children lacking these basic needs varies on location, socioeconomic status, and of course, the color of their skin. In Harris County, for example, 25% of Black children and 18% of Hispanic children experience hunger on a daily basis, compared to 7% of white children. Additionally, lack of rest is a major barrier in a family's success in life. For children of color, barriers to rest and resilience often include neighborhood and environmental factors like light and noise pollution, crime, sense of safety, access to green spaces for rest and recreation, and access to fresh foods at grocery stores. We often see that the adverse effects of structure or processes that disadvantage non-white families also factor into a child's sense of safety and security. And so our report identifies the following disparities in the acquisition of basic needs: sleep, food, shelter, school nutrition. If we could go back a slide, I will review the access to fair justice data. Thank you. Research shows that even one out-of-school suspension increases the likelihood that students will be held back in school, will not graduate on time, and will have future contact with the justice system. In Texas, Black girls experience the greatest gender disparity in discipline across racial groups. They're suspended at higher rates than their Black male counterparts, through both one or more out of school and in-school suspensions, 34% compared to 29%. The State of Inequities Dream Deferred takes a look at how children of color in Texas experience unfair justice in the school to prison pipeline, disparities in school discipline, and discrimination based on appearance. Next slide, please. We've also taken a look at access to quality education. Receiving quality childcare and education from birth to high school is a major determinant in a child's success. Roughly 1 in 10 Texas children, ages 0 to 5, with working parents live in a childcare desert. Working parents who struggle to obtain quality childcare for their young kids are limited in how they can provide for them. For many Texas school-age kids, major hurdles and inequalities inside and outside the classroom keep them from gaining the knowledge and skills that they need to meet life's challenges. So our report delves into the necessity for equitable access, the lack of access to early childhood educations, and inequities in K through 12 education. Next slide, please. And the next one. Thank you. So, what we hold as a core value at Children at Risk, of course, is equity, because we know that Texas childhood is different depending on where kids live, depending on their socioeconomic status and the color of their skin. And so I'm pleased to have shared our 2023 equity report with our experts. And this panel on finding a way to good health will be moderated by Dr. Sean Haley, who's Executive Director of the Center for Civic and Public Policy Improvement. And the panelists include Dr. Anjanette Wyatt, who is President of the American Pharmacists Association Foundation, Sarika Barlow, CEO of the YWCA El Paso del Norte region, and Nakenya Wilson, who's founder of Restore Family Support Services. So glad to have you join us. Dr. Haley, as you begin to moderate, I want to ponder with you the fact that Texas is in the bottom quarter of states when it comes to both access to and quality of care for families of color. And we will have a report coming up on growing up in Houston that shows some dismal rates of prenatal care for Black women who are expecting in Harris County. And I'm curious to know, what are your thoughts about that? And as you moderate this panel, let's talk about not just the data and the problems, but let's also talk about some solutions.
Absolutely. Thank you so much, Sharon. And I'm so happy to be here. And it's an honor to be able to facilitate this panel. Immediately when it comes to those statistics and that data that you were just sharing, the obvious words that come to my mind and swirl around the need for, obviously, the Medicaid expansion that would really help to provide additional supports, the lack of access to caregivers of color in particular, and in general, just the lack of access to caregivers and the dilemma that exists both in the state and nationally around that. Also, in seeking to reduce maternal morbidity and mortality rates, there's definitely a need for extending current policies during this session and the need to press for that. And then finally, I absolutely love, and I'm glancing down, the one of the multiple recommendations that were really super strong from the report was the reestablishment of the Office of Minority Health Statistics and Engagement, which will play a significant role in looking at tracking and being able to, provide those additional supports, or at least move resources in the direction of providing those types of support. So with that, I'm looking forward to the panel really delving in and sharing more knowledge and being able to uplift these things and help us out. So if you would, I'd love to just jump in with the
Please
panel.
do. I will turn this over to you, and thank you so much for being with us.
Absolutely. Thank you so much. So first off, just for our audience, please be aware that all the bios are available to you. And so we won't spend a lot of time, because we do have a brevity of time within which to work this morning on that. But just in short, again, Dr. Anjanette Wyatt, President of National Pharmacists Association. It's so great to have you. Nakini Wilson, founder of Restore Family Support Services, and our last but not least, former Lieutenant Colonel Sarika Barlow, who's CEO of YWCA El Paso Norte. We want to jump in with a few questions. I'll start with one that bubbled up as we were talking about this particular panel, and it really has to do with this idea of and the notion of social determinants of health that hinder Black families. When it comes to health disparities, there are many folks that talk about the negative impacts of social determinants of health. Now also people are talking about non-medical determinants of health and couching it in that language for purposes of political palatability. But would you please share some insights into how social determinants of health hinder Black families? And I'd love for Dr. Wyatt for you to lead off in this area, if you would.
Absolutely. Thank you, Dr. Haley. I just wanted to, home in on the fact that social determinants of health, it affects everything about your life expectancy, and especially in our community. The determinants of health are conditions that we were born in, the conditions we live in, we learn, how we learn, work, where we work, worship, and where we play. And for Black communities, that means that the income level, the family dynamics, for example, single parent household, which is higher in the Black community, and also access to healthcare, of course, with health disparities, and access to, for example, fresh food in food deserts. All of that affects the Black family and the Black community. Also, I want to home in on vaccination rates among African Americans and children, Black children. That also is an issue when it comes to health disparities. And one of the things that we need to look at is COVID, for example. In our community, the death rate was twice as high as the death rate in other communities, and we had a lower vaccination rate. And so we started initiatives to get that COVID vaccine out and administered to communities of color. So absolutely, social determinants of health really affect our community, and we need to really home in on that, especially for Black children. And it definitely has to do with your socioeconomic status and socioeconomic level in America, and especially in Texas, because our numbers are really, really high when it comes to access to healthcare, health disparities among Black children and Blacks in general.
Absolutely. Thank you so much for sharing those things. And some of the things you noted as you were going through that round of information will be highlighted a little bit further. We'll have a chance to further talk about vaccinations and things of that nature. I noticed some of the other panelists kind of nodding as we were going through this conversation. If anybody else would like to chime in, Ms. Barlow?
I love what Dr. Wise shared. And I have, as you've shared, my military background, but I've also been a healthcare executive for 25 years. And now I'm enjoying this nonprofit world. But in the study that was shared earlier by Sharon, it spoke about childcare deserts as well, and how that increases that disparity, because if a parent can't have their child cared for, they can't go to work. And that just goes along with all of those that were already stated. And so it's also important, and particularly right now, it's finally come to light about childcare is one of the largest industries in our nation, and it is in a crisis right now. So in our Black community, if we can't also address that, then this is going to continue to tumble and roll and build up, that they can't have access to care, they can't have access to education, because you can't even get to those places if you can't care for your child to go out in the door to strengthen our workforce and our work industry. So I just kind of wanted to add that on to what we're also dealing with.
That's great. And I know Ms. Wilson has a rich background with helping families and working in the educational sphere as well. And all these social determinants of health show up in so many different ways. I know even at the Center for Civic and Public Policy Improvement, where I'm the executive director, we focus on, that affordable housing side and the intersectionality of that with criminal justice and just the numerous things that plague Black and Brown communities, communities in poverty. Would you like to add anything to this conversation on social determinants of health?
I think I want to say what we would probably agree is obvious, but sometimes it is something we don't want to touch. But the social determinants of health, when we look at the groundwater, right, of how we end up with these social determinants of health, specifically for Black people, it is rooted in racism. So when you start looking at access to healthy food, health care, where we live, environmental, injustice, and all those things are from systems that have been built that have not been built for us, I guess is a better way to say it. And so I think we have to name that, because if we don't start from the very root and we just start talking about social determinants of health, then I think sometimes that's a way for us to kind of like dodge the other part, which is we still are battling racism in this country.
Yeah, that's great. And thank you so much for highlighting that. And I see the audience really reacting and responding to that. We can dig in further. You actually, spoke to, I think you used the language of inheritance of inequities, which really highlights what you're saying. You're so right. Sometimes we use language initially with probably greater intent, then as it's used over and over, may become watered down, which I feel like you're pointing out here. The other thing about the social determinants of health language, I know, was in response to also really building off that idea that, listen, it's not inherent within people that these things are made manifest, right? It's not necessarily that which is within Black folks, brown folks, those who are experiencing these things. And so that definitely is very important. But I don't know if you'd like to share any more about kind of your thinking on, through your experiences with advocating for families and your insights on the inheritance of equities. If you'd like to speak any further on that, it would be great to hear more.
Yeah, so when we were talking in preparation for today, one of the things that I, was talking about is this inheritance of inequities and how we start behind the ball. When you look at historical and generational trauma, and it began in slavery, you have generations of people who have been subjected to trauma, violence, stress, that changes the way our bodies work. It changes the way that we show up in terms of our mental health. And so when you get further down the line and you start looking at maybe morbidities in health, right? Or behaviors of students in schools, again, you have to go back to where does that begin, right? If a child has 4 or more ACEs, or a person has 4 or more ACEs, they're more predisposed to mental health, to chronic illness, to substance use, and all of these different things. And if we're not careful, we'll say, well, there's so many more Black kids that are doing X and Y, or so many more Black people that are doing this. Well, they need to eat better. They need to study harder. But the reality of the situation is that they've not been given what is needed to thrive. And it's not inherently something wrong with them, but it's the systems that have harmed them over time that we're really battling.
Yeah,
Dr.
thank you so
Casey,
much
can-
for lifting that. Go ahead, go
Can
ahead.
I jump in there?
Yes, please,
I
absolutely.
would like to add the part, and absolutely there is an abundance of racism that exists, but there is also institutional racism. It's like we are not only battling what we see, but we are also, our children and parents are having to navigate in a system that is unseen, and that hidden racism that exists. And it's like you don't even know that there are opportunities out there that are better than the opportunities that are being offered to you, brown skin, Black skin person, because they figure that it's not something that either you need or that you can afford. So oftentimes we are not offered the best, and they don't even understand. And I say they as the system. The system doesn't even understand that that's what's occurring. They just behind the scenes have empowered themselves based on some of the ignorance that they have carried on from generation to generation to have our kids, our beautiful brown and Black kids, be underserved.
And Dr. Haley, I want to jump in as well. This what we're talking about, the injustices and things of that nature, is seen prevalently in maternal mortality. I just want to say that because a lot of times Black women, or just the Blacks in general, are not seen or heard in terms of their issues when they bring them forth to the healthcare facility or to the education department. They're not seen or heard or validated in their concerns. So that's prevalent right now. We need to make sure that we listen to our Black community and have our voices heard. We are definitely battling an uphill battle with the racism in America and all of the other things in education as well.
Well, I love what you all saying in terms of this issue and moving towards resolution. Within the report, the State of Inequity, it is pointed out that the American Medical Association, I believe, has highlighted, their understanding that a lot of the resulting factors that we're discussing are based in racism and biases and things of that nature. But what, one of the things you were raising was getting to those solutions of lifting voice. Are there ways that you're seeing people maybe doing that now? How are folks bringing forward the voices of those who need to be heard? Are there, any organizations you're aware of? I know that there are some movements taking place, and within abundance of movements, people try and elevate voice by even having folks do mini recordings on their own iPhones, right? And submit those as testimony and things of that nature. Are you seeing that? Are you involved in any of that kind of work?
I guess that's my cue. I think we have to come to a place where we recognize that we all have a part to play. And when you think about a symphony, it's not a symphony if there are not different people that are playing different instruments. And one doesn't sound good without the other. And so there are a lot of ways that you can get involved. There's a lot of organizing and power building that needs to take place. And I would even say across Black and Brown communities in order to really accelerate the change and the impact that we need to see. So that's one realm. And that could, also look like advocacy and activism. And I know that's a dirty word, and many of us come from previous generations that are like, don't do that. But there's a place for that, and there's a time for that. But in addition to that, we have to also work within the systems. And so one of the things that I am a maternal health advocate and activist. And when the maternal mortality and morbidity report was not released last September, even though I'm on the committee, I'm also in community, and I rallied statewide with other people to pressure the state to release the report. And we had a press conference and we had a rally on the Capitol steps, and that report was released in December. So I was working within and without outside of the system.
Another thing I want to point out is that, for example, a lot of times the state doesn't understand that, in order to get more better healthcare, we have to have access. And that's just in a general for children all over the state. Pharmacists have been rallying the Texas legislature to have us to immunize children at a lower level. We're approved to immunize adults, but you see your pharmacist far more than you see your actual physician. And if they had access to just come in and bring those children to get immunized, that would solve a lot of the issue. It was prevalent when COVID occurred because the PrEP Act allowed us to go ahead and immunize those children. But just think, if we had the law in place to immunize all those children, then they could just come straight into the pharmacy and get their immunizations without having the parent to make a doctor's appointment, then have transportation to the doctor's office and all of that. So it's a lot of work that we have to do on the legislature side to get some of these bills passed so that we can have more access for the Black community.
Dr. Haley, I'd like to also add, we have a history as a people of medical mistrust. And what I mean by that is we don't trust you, doctor, who doesn't look like me. And I think in error, trust those who look just like us. And so I would say, first, we have to recognize sometimes we are our own worst enemy, because as you've heard that saying, what is it? The squeaky wheel gets the most whatever. We'll go to a doctor's appointment because we don't trust the doctor and not say anything. We would not share our issues, what we see our children have, that cough, that scab, that rash that was occurring. And then we wonder why we are not offered the same thing. Well, we don't advocate for ourselves. And so I think we have to, as you started this off, you spoke about our voice. We have to have that same voice. Maybe you know how to polish it up differently when you're not inside of your house than when you're outside of your house. But we have to have that same voice that we talk inside of our house on protecting our family and keeping them safe. When we go into places amongst people who don't look like us and speak. And if you can't speak it, you don't have that health literacy, then call your cousin, your friend, your neighbor, whatever it is, and say, you know what, can I have you come with me, or can you come into this visit when I call you in so you can make sense of what this person is saying? But we have this thing where, I don't trust them, so I'm not going to tell them nothing. And then we wait till we are broke down and hurt and about to die before we go get help. And then we say there's this disparity. It is, but we got to do a better job advocating for ourselves. That's what they do. And we need to start doing the same.
Oh, I'm sorry. I was just going to note that there are a couple of questions that are popping in the chat. I think we're touching on some of those, and I hope don't forget what you were about to say. Cross your fingers. That was an old trick I used to do. But the question that Carol Massey lifted was, regarding, we know that the racism and poverty are root causes. What are those strategies? When do we move on these issues? And I feel like you all are responding to that now. And I do want to kind of put that extra highlight on the fact that, there's not as much, or it hasn't seemed to be, and maybe there is some bubbling up of this, of more Black and brown communities coming together through vocal groups in order to help activate. That was one thing that was lifted, and there were several others, but I thought that was really astute. You guys wanted to say some other things, please jump back in.
I was just going to add that, I thank you, Ms. Barlow, for that perspective, but I also want to add another dimension to that. And the medical mistrust is real. Statistically, when we look at, and there's a report that just came out from the New York Times about the wealthiest Black women in this country still have worse maternal health outcomes than the poorest white women. We also have another study that says that Black children have higher mortality rates, infants, if they have a white doctor. I'm from Fort Worth, 786 or 787, what is it? 76104. It has the lowest life expectancy in the entire state of Texas. And I share that because I have an uncle who has terminal cancer. I have an aunt who has a trach and has a respirator, and I have a master's degree, and and they also battle with mental health. Navigating these systems and advocating is not for the faint at heart, even when you are educated. So I want to hold space for the fact that people get discouraged and they feel hopeless. And so I just don't want it to come across that, we're blaming or that we're criticizing, but what we're doing is we're saying, you deserve to have the same treatment.
And I want to say really quickly, this is Dr. White. I want to say really quickly to touch on what Ms. Barlow and what Nakenya just said. A lot of times Blacks need a health advocate with them to go to the doctor, to go to the hospital, especially in the hospital settings. Stay with your loved one in the hospital so that you can be the voice for that, the patient in times, because a lot of times these things happen when they're alone, when they go to the doctor alone, when they go to the hospital alone, when a pregnant mother goes to the doctor alone. So always take someone with you, some health advocate that can speak on your behalf.
Thanks for raising that. I see Sharon's pop back on. What do we have, about 5 minutes here, 3 minutes?
Sorry, we're at the end of our time for this session, and man, we could really talk about this on and on and on. And what I want to also point out, you mentioned one of our recommendations earlier about reestablishing the Office of Minority Health. I also want to say a lot of what we talked about in terms of systems that contribute to racism or that perpetuate racism. One of our recommendations is to measure disparities in education, health, and human services, because if we're not measuring it, it's very difficult to get our lawmakers to take a look at it. And so what we're asking is that the Sunset Advisory Commission assess these key state agencies' efforts to reduce disparities as part of their regular review process. And so we're specifically asking that they do this in education, Texas Education Agency and HHSC, so that we can begin to address some of these data points that we know exist.
Absolutely. Thanks so much for popping on and closing us out. One thing that we did mention, and just in response to some of the questions, the pipeline for getting more Black medical professionals is critical and of utmost importance to this. And so it was touched upon briefly, but that's another aspect that this panel really kind of talked about and wanted to look at.
And Children at Risk takes a look at that also. Later in the year, we will have a full summit related to encouraging Black and Brown children to fill that pipeline of STEM careers, including medicine. And so I hope to welcome you all back so that we can discuss that in detail. Thank you so much. As we get ready for the next panel, we're going to talk about paving a smooth path to fair justice. As you know, a child's trajectory can be altered severely by a single unfair or unjust interaction. Black children have disproportionate risk of these unfortunate circumstances. Our panel of legal experts will now examine the issues and prescribe measures to increase the chance of their fair justice. as I invite our moderator, Davika Kornbacher, who's co-head of the tech group, Clifford Chance, and a Children at Risk board member and past board chair. I want to point out a couple of our recommendations from our 2023 equity report that touch on the disparity of discipline in schools, as well as how we can change this trajectory. In particular, we're talking about passing a Texas Crown Act, which creates a process to protect students and reduce hair discrimination in academic settings, and to end this form of unequal discipline and unfair dress code systems. And also, we want to define, categorize, and report chronic absenteeism, because we know that students who are chronically absent in any year they're more likely to drop out of school and more likely to end up in this pipeline from school to prison. And so as you all will turn on your cameras, in addition to our moderator, Davika Kornbacher, we are welcoming Joe Herbert, who's the founder of Defend, which he will describe for you what that organization is doing to pave a smooth path to fair justice. Attorney and author Trina McReynolds Bailey, and Nashawn Edwards Sr., who's professor of community development, University of Texas, San Antonio, and Kansas State University. Thank you,
Excellent.
Davika.
Thank you so much, Sharon. I appreciate that. And Sharon, I really do encourage you to read the report, because even though I know some of it, it's astonishing to see it again. And Joe, I know we'll get to some of your work, but looking at there's twice as many police as counselors in our schools, right? That there are, and this is in the report, that you are 2 to 3 more times as a Black child being arrested as a white child nationally. But in Texas, it's 4.75 times more likely, based on the past, that a Black student will be arrested at school than a white student. And the number is there for the brown, but it's not as high, right? And so this is about the state of Black children. So I want to kind of set the school to prison pipeline in the frame, because we're going to talk about fair justice. Fair is supposed to be without discrimination, right? And then justice, you think, oh, that's the same thing. Fair and justice, aren't they the same? But when we're talking about justice on this panel, Trina and Joe nodding, it's more about the justice system, that shield that you see in the report. So we're talking about shield and scales versus the actual fairness being without discrimination. So on that, I think I won't go over what we all know, meaning there are 2 things at play here, right? There's the system. The panel before talked about it. The system needs some evolving when it comes to this. But then there's also us, the Black parents, the Black community people who have to educate the Black children about how they're seen. So I want to start there and maybe go to you, Joe, first about that, because we've talked about this, about how you feel about the system, but I want to ask the question, in paving this path, this smooth path to fair justice, is this more of a, we got to change the system because that's our only way to do it? Or is it, no, actually, we need to change how we're educating our children, or telling our children, or something else, Joe? Can you tell us more about your views on that?
Well, I think we have to change the system, but the way you change the system is to help people. I mean, because the system is made up of people. And so when you help a kid and you change the trajectory of his life, then that's gonna make the system better. For example, the organization that I started, it was inspired by a kid that I was asked to help in June. At that time, he was facing 2 years in prison for a crime that he actually committed, but the kid had a lot of potential. Monday, he signed a scholarship, a full scholarship to one of the most prestigious historically Black colleges in the country. I can't say which one it is yet. But so you have this kid who was headed to prison, now he's going to an HBCU to rub shoulders with the future leaders of America. To me, you change the system by diverting as many people, and not just the kids. Like, when I help that kid, I get better. When it was about maybe 30 people who helped me help that kid. They all got better. So I do think you change the system, when you get involved.
No, that's definitely key, right? We do have to change the system by changing people. But we also have talked about before, Joe, and Nishan, maybe we can go to you on this, and Trina, please hop in whenever, but that there's a certain lens that our Black children are seen through, right, by that system.
And
So,
real quickly, that part, I'm
Yeah.
very pessimistic about changing. I mean, it's been going on since before we were here, and I just don't see that changing. So I think it is about educating as many people as possible. You don't want that system smoke.
it's true.
And I'm not as pessimistic as Joe, but what I look at is when I was in law school, I was told good lawyers know the law, but great lawyers know the judge. And
Come on.
when you only have 4% of attorneys nationwide, Black attorneys nationwide, the reality is that we have to work a little bit harder to get to know that judge. And the outcomes that Black children are going to have are going to be directly impacted by the representation that they do or don't have.
Mhm.
And while I'm not pessimistic completely, I think there's an opportunity there. And I think I get really optimistic when people like Joe step up and fill a gap that they see. And I think the last panel did a beautiful job of illustrating just how important it is that there be a widespread attack on issues that are prevalent, whether it's from the pharmacy perspective, whether it's from a nonprofit perspective, whether it's from the actual medical providers. I see that there's opportunities there that people are filling.
Absolutely.
Yeah,
Rashawn?
and I would. Yeah. Can you hear me?
Yeah, you got a little bit of an echo, but
Okay, can you hear me now?
yes.
Okay. To Joe's point, I commend you for what you've done, and I think that a really good starting point that we can identify that we just don't necessarily talk about is really like the improvement in community and the effect that it will have on our children who aren't often included in the discussions, the big discussions, or even at the table. Growing up, I always heard that the table is for the grown folk. But now, as I sit here today, I see that, man, our children who are our future, you never tend to invite them and get their feedback and really create space for them to say, hey, this is what I want my future to look like. So we do a lot of good things in silos, but if we get to the point to where we can actually collaborate in all endeavors to really invest in our children, with things such as dropout rates would be wouldn't even be a thing. Food insecurity wouldn't even be a thing, along with other social issues that affect our youth that cause them to turn into what's what I'm looking for, and to engage in behaviors that will ultimately affect their futures in a negative way. So that's my spill on community, and I give it to you.
That's great. Well, I mean, here's the deal. I always say that all children are going to join an enterprise, and it's up to us whether it's the criminal enterprise or a building enterprise, right? Like all children are going to join enterprise when they become adults. We get to help them shape that. And Trina, I know that you have spent some time writing and really trying to educate, helping a teen make it through and how to become an adult and questions they should be asking. So I think one of the things that it's key to this from the previous panel too is education, right?
Absolutely.
For health, education is key. And so where do you see education in this space, smoothing that path? Where do you see it? And then who really needs it and how do you get there? I know that's a compound question, so you can object to it, but I'm going to ask it anyway. Where do you see education's part?
Well, I think that's why I'm also so positive, because I think the access to information has never been better than it is right now. And I think that if we disseminate information that it's reliable, it's from a credible resource, and we reach kids where they are, I'm very hopeful that they will know enough information and they can use their power for good and not evil. That's a thing I tell my kids all the time. And so I think that piece, I read a statistic the other day that 1.6 million people have visited the Holocaust Museum, but 10 million kids who did not know that the Holocaust existed. Now listen to this, 60% of kids don't know the Holocaust, right, happened, but they reached 10 million kids in TikTok. And so that's the kind of thing that makes me think, boy, there's opportunities there. These little 30-second videos, these 3-minute videos, the social media platforms that are available, they can be used as a powerful tool to reach kids where they are. Now, the responsibility where I see teachers, I see schools, I see administrators. I see that really as the front line before they get to the criminal justice system. Families aren't responsible for the administration of fair justice, in my mind, right? They don't administer it. They don't make those decisions, but they do decide if for summer their kids are spending it at Boys and Girls Club and YMCA, or seeking out opportunities for them to have productive uses of time. They do decide to make sure that their kids are getting to school every day, so there's no truancy charges. They do decide on so many factors that could directly impact whether there's any involvement with the criminal justice system. And I think the communication piece cannot be undervalued. And that means communicating needs. A lot of times we're very proud and we don't want to admit we have a need and we don't know how to address it. And it was probably in Joe's case, I know one of the stories he's told me, it's probably too late by the time some people come to him. And it's only out of sheer desperation that they reach out to Joe for some help and some counseling. So that's back to your first question. I think that educating people about where these resources exist so that they know when to reach out and reach out earlier rather than later will make a huge difference for kids.
Absolutely. So, and I know that all of us on this call are advocates of education and products of it, right? That education made a difference in our lives. But Joe, to Trina's point, but you have to know where the resource is, right? To be educated, to be helped. Can you talk through like what you've done with Defend and other places in getting that word out there?
So our primary fundraising mechanism is networking events. And the purpose of those networking events is not just to raise money, it's to raise awareness, both of what we're doing and what other people are doing. So I'll reach out to somebody with a similar, somebody like Nakenya Wilson at Restore Family with the mission with some synergy and say, hey, I'll do a fundraising event for you, you do one for me. And we make people aware of those initiatives. And so I'm just a big proponent of that kind of collaboration where you're working with several organizations and you bring people together, because there are some people who are not, going to be moved by what I'm doing, but they may be moved by what you're doing. And so I just think we need to have that collaborative approach to seeking support for all organizations.
Agreed. And Deshaun, I think you're a great example of that, right? With the focus on community development, the whole community coming together to help the child. I think in that though, we all have to acknowledge there is a disparity now in how our children are viewed and how Black children are viewed. And so, Trina, I hear you. It's not necessarily the family that administers justice, but I do feel like I have to have the conversation with my mixed race child about it doesn't matter that he's these other races, he's going to be seen as Black.
Right. So
therefore, I have to debate whether or not he's ever going to get to wear a hoodie. I'm just being real. And so, Nishan, but if you could talk through like about that piece of smoothing that path is how do we educate that child without crushing them, right? And saying like, you can't wear a hoodie, Black boy, because that's going to get you in trouble with the law. How do we navigate that? Oh, you're on mute.
Okay, can you hear me now?
Yes.
Okay, great. I do believe that it's essentially a marriage of one. Well, the first step really is it's a marriage of a lot of parts, but like the first part is really that home piece, because the home piece, they are responsible. The mother and father, they're responsible, or the mother, father, they are responsible for creating that moral foundation for that child. Okay. However, generations change. We tend to pick the good, or pick what we liked about growing up, and intertwine it into raising children, and things kind of change. But also too, uh, in the Black community, we used to lean a lot on the church. We used to lean a lot on these support groups, these clubs, these social. We used to lean a lot on them to really just, okay, this is what I can do better as a parent, as a person, for my family. Now we've gone away from that, and now we lean a lot more to things such as TikTok to really just try to raise our families now. And that's fine, but it's nothing like that human touch and that human conversation to really get that understanding. And even you talk about the family, you talk about the church, even the banks, just that financial literacy piece, right? To like really just, okay, I'm gonna go talk to my banker, first and last name. I can tell you where they stay. I'm gonna go back, I'm gonna learn this, and I'm gonna teach my child that 1+1 is 2, right? We don't have those conversations anymore. And again, that moral piece it's a lot more to it than right and wrong. It's really just like how to really just navigate this life. So when you get to a certain age, you understand, like, okay, this is right, this is wrong, from a financial perspective, from a social perspective, from a religious perspective, whatever. But because we've essentially we've divorced the church, we've divorced the banks. Our relationship's not that good, so I don't want to go check with them because I know I don't have the money. I don't want to go. I don't want to go talk to the school, to the teachers, because she say something wrong to me. I got a problem. We've divorced all our tools that really make us a community. Now we operate in silos, and it's just like, man, like where's the where's the good? So we can definitely walk all that back, but I really believe that step one starts in the home, but it has to be a education, especially for parents. If they don't know better, then they're gonna do what was done to them, which isn't
Right.
always good.
That's
So
right. Yeah.
so that's why that's why it's important to have one education piece. And again, the education can definitely be informal too, because I think everybody on this call can say or know that book smart can take you somewhere, but that street smart,
I mean,
that can definitely
yeah,
help.
it is the
So
difference. Yeah.
yeah, it's a big difference. So definitely community. We gotta marry all these things, and just like understand. Yeah, we had a divorce, but it's time to come knocking again, so we can get it done.
Reunited, and it feels so good, Michelle.
So good, yeah.
So look, we've got only like a couple more minutes, but it's been a great panel talking to y'all. I'm gonna give like 30 seconds of hope, because Sharon challenged us. We came up with some solutions in this, but like to be solution oriented to how we're doing this. Can you tell me, looking at smoothing this path to fair justice for our Black children in Texas, what does give you hope? Trina, you shared a little bit about this, right? But I want to unpack it a little bit more. So let's start with you. We'll go Trina, Joe, Nashawn.
I'm going to give you two numbers, 60 and 2.2. In 1940, 60% of employed Black women worked as domestic servants. Today, that number is down to 2.2%, while 60% hold white collar jobs. And this is important because we know that Black children are disproportionately being raised by single parent homes. But this gives me hope because the homes are going to have access to resources, both financial and information. They're going to have a network and a community to reach back to and to support them. And so I think if we continue to educate, and not just about, stay out of, bad situations, let's avoid interventions and interactions with police authorities. But if we educate people and get them into colleges, I think it improves outcomes for all Black children.
Excellent. Thanks, Trina. Joe?
One thing that gives me hope is every single time I've gotten involved in a case, it's made a difference. I mean, when a kid goes before a judge and there's nobody there to advocate for him, if they're intent on giving him a harsh sentence, that's what he's going to get. But if somebody shows up and humanizes that kid, every single time I've done it, it's made a difference.
That's good.
Excellent. And I don't know if we lost Nishan, but I see Sharon. So that might be it.
Again, this has been another panel that has left me personally and those in the chat really wanting to hear more. And so I thank you for that. And it's such a wonderful segue into our next section as we talk about a bridge to quality education. But thank you all. Thank you for what you're doing for kids.
Thank you,
Some of
Sharon.
those same recommendations that were made for paving a smooth path to fair justice that are in our State of Inequity report also apply to building a bridge to quality education. When parents, educators, and communities work together, kids win. We've invited educators to share innovative strategies to address pandemic learning loss, the digital divide, and disparities in school discipline that we know from our report are hurdles to success. I'm so pleased to have my colleague, James Durden, who is the academic performance coach at Texas A+ Challenge, a part of Children at Risk, to moderate this panel. And our experts include Catherine McCartney, who's CEO, Head Start of Greater Dallas, Dr. Marla Shepard, who's Deputy Chief of Academics, KIPP, Texas, here in Houston, Dr. Damian Cook, who is Principal of the Mickey Leland Young Men's College Preparatory, and Dr. Kalila Campbell Roan, Assistant Superintendent of Transformation, Houston Independent School District. James, I'm going to turn this over to you in your capable hands, and I'm looking forward to this full discussion. Thank you so much.
Well, thank you, Sharon. We just heard a conversation about paving a smooth path to fair justice. And I once read a stat that said that the number of beds that correctional facilities will need in the future comes directly from third grade standardized test scores. And to add to that discussion, what we want to do is to talk about building a bridge to quality education so that we don't have those needs for the beds in the future. And so I'd like to start with Ms. McCartney. I have a question for you. I'd like to know, we know early access to quality education is important. We know that. And so what is your organization's role in empowering students and teachers to be successful?
Okay, I think one of the major roles is to bridge the gap with the families and the schools. And one of the ways that we do that is toward family education, parent as partners, one thing. When our children first enter into our facilities, they become part of the organization, and we get to know the families through home visits, through assessments of the children. We look at that assessment, sit down with the parent and talk about what we found with the assessment, talk about what the parents' goals are for the child. And part of that is done through the home, so we can get to know the families in their natural environment, so we can plan for the children in that manner. And I think that also helps the teachers have a smooth transition into the classroom with the children. One of the things we always tell our parents is that we are there, you're the expert with your child. We don't profess to know everything about the child. We want you to tell us what your goals are and what you want to see happen in the classroom. Come to the classroom, visit in the classroom, come to parent night, come to the parent meetings, get to know the staff. So I think that bridges the gap where both entities are successful.
Okay.
And I think children also see if it's a good relationship between the teacher and the parent. That helps the child as well.
Thank you. And Dr. Campbell Roan, in your role, how do you see empowering teachers what do you guys do to empower teachers to succeed? And how can schools best equip teachers to be successful?
Good afternoon, everyone. And thank you for the question, Mr. Durden. I think the first thing that we have to do to empower teachers is to actually remove the barriers that teachers can face on a campus. There are so many extraneous activities that we ask teachers to do that really get in the way of what teachers really need to do. So we have to keep our eye on what is important and make sure that every single time we're going into a teacher's classroom, we're eliminating the distractions that could get in their way. The second thing is that we have to provide them with a high quality instructional material. And the reason I say that is because a lot of times we get companies that come in and say, this is the greatest and the best. And they catch us hook, line, and sinker. And we end up purchasing things that may not be what's best for our students. We also get to a point, especially with the COVID gap that students are experiencing, where we start teaching down to students instead of teaching up to students. But with the high quality, grade level instructional material provided for the teachers, one, that eliminates the amount of time they have to spend planning and finding things. They're already there for them, and they can ensure that they're teaching on grade level, even if they have to scaffold up for the kids. I think the other thing, and probably one of the most important things, is that we have to provide tier 2 leaders that are strong enough to go in and teach teachers to help them fill their gaps where they may experience gaps. We can't just say this is what effective tier 1 teaching looks like. We have to be able to coach teachers into that. And we're now dealing with millennials who don't hold on to jobs as long and as strong as people once did. And so we have to find a space where we're giving them enough tools to be successful in the work that they're doing, so they don't say, oh, this is not for me, and leave the profession. And then the last thing is that we have to give them a place to plan. And it has to be the time needed and the resources needed for them to have effective planning, because we're always looking for the execution of great planning, but we usually don't spend enough time and afford enough time to our teachers for them to have they don't have the time to do what's necessary for the execution of the plans to be good. And then lastly, make sure that in that planning, things are very succinct, because if you ask people to do too much, it's out of their wheelhouse, you're not going to get what you're expecting to get. So it needs to be bite-sized pieces. It needs to be very clear what it is that you're expecting to see when you go into the classroom. You need to provide that opportunity for them to plan to make that happen, and then support the execution of it through coaching.
Thank you. And Dr. Crook, I'm gonna bring you in for a second. We know that having advocates is instrumental in student success. How can parents effectively advocate for the needs of their children? And what's the importance of having parents as partners in educating their children?
Well, that's the age-old question, is how best to advocate for kids. As a child advocate by profession, I can say the primary key to any type of advocating for children is communication and being present and being involved. Dr. Rome mentioned that we have millennials that are teachers now. We also have millennials that are parents. And so often, many of those young folks have seen school as the enemy during their tenure as a student. But what we have to do is pull back and reteach them about advocating. So the first step, like most schools do, is we start with an open house and we begin having parent meetings at the beginning of the year. But that should not just be relegated to the fall and to the spring, or when it's time to reach out and have said parent meeting just to check a box. It should be something that happens continuously during the school year and even the summer. Communication is key, but it also needs to be a two-way street. Parents have to first remember and keep in mind that communication that flows in one direction is just a sounding board. Speak back, ask questions, advocate for your child, ask the difficult questions. Even some of the best schools, some of the best educators still should be pushed and challenged. The key, again, is communication. And last and finally, I'll say, having parents as partners is essential. Again, mentioning my own profession as a principal, as the advocate from 8 to 5, I need a partner from 5 to 8. So if we can talk and speak the same language as partners, then we'll see us moving from point A to point B and actually getting close to the goalpost, to the goal line, should I say, so that we can see our kids grow. And when kids see that and know that they have parents as partners with their school, and a child, the children typically pay attention to that. And they'll light up and know, hey, my parent, my mom, my dad, my guardian, my grandmother, or whomever is acting as that child's guardian, that kid pays attention to that. They notice it, and it does something to a kid. It creates sort of a pride, if you will, that my parent deeply cares enough to come and advocate for me and be present in my school. And it goes on, it does not go unnoticed, should I say.
Okay. And Dr. Shepherd, I'd like to pose the same question to you. How can additional parents be advocates for their students, and what is the value, the great value of having parents as partners?
Well, good morning, everyone. First, we have to acknowledge that parents are a child's first teacher. And so advocacy for children begins long before children go to school. There is a correlation between oral language and written language. And so as parents, when we're in the home, making sure that we have good, wholesome conversations with our children before they hit school, because those oral language conversations will actually help them to access the written language. And then once they get in school, it's important for us to advocate based on the needs of the child. Every child is different. I have 3 children, and all 3 of them have needed for me to advocate differently. And so we know that as kids move up through the system, sometimes as parents, we believe that we should take our hands off the older they get, when that's actually not true. We need to continue to advocate, but in different ways. When children get into middle school and high school, we're not going to have lunch with them, and we're not going to go read on the carpet to the other classmates. However, there are things we can do. And one of the most important things is that the teachers at the school know who you are, and that the principal and all of those leaders at the school know who you are, and they know that you are a partner in your child's education. And then if there is something that they need to know, that the educators need to know about your child, then make sure you disclose that, because it's important. If your child is going through something at home, or if your child has some type of anxiety that the teachers or parents or the school people need to know about, it's important that you disclose that, because as partners, we have to make sure that we're doing what's best for our kids. And the school is the partner, and they are the parents when you are away. And so having that parent means that we have to make sure that we disclose all those things to them, and that we're also very active. Anytime the school has some type of activity that allows for parents to become involved, it's important that we attend those things. The advocacy for my children, my oldest daughter did not need me to advocate as much for her academically. However, my second child, and I think Dr. Crook knows him, we had to advocate a whole lot for him. We had to make sure that we were active parents. So I think listening to your children is very important, and listening gives you the pathway to advocacy.
Thank you. Dr. Camberon, we know, in addition to being an advocate or having advocates, what interventions do we need to have in place, especially for Black children?
I think one of the most important things that we can teach our Black children is to advocate for themselves, right? And in order to do that, you have to know what is best for me, what is most powerful for me, how do I learn? If I sit in the front of the classroom, do I absorb more of the information than if I'm sitting in the back? Do I take copious notes? Does that help me? Or does it help me if I have a video of something and I can rewatch the video? I think we have to advocate for our students, not just to use their cell phones for social media, but also to get on Khan Academy and to use that as a tool to study with. We also have to train our teachers in cultural awareness. We have to have teachers that understand when a little Black boy is clicking his pen, it's not because he's purposely being disruptive in the classroom, but because the rhythm of the pen clicking helps him to absorb the information that he's being told, helps him to put a cadence to the words and to remember them. We also have to remember that there are so many advantages in 2023 that we didn't have 30 years ago. Community services, wraparound services for our students. We have to help parents to be able to advocate for those things for their kids. and to know that they exist. So I think that when we're talking about the interventions that must be in place, there must be a place where students can go when they feel that they are not being given the correct services in the classroom. We have to teach them who those people are on the campus, and then what to say when you get to those people. We have to teach parents what to teach kids to say when they get to those people. And for kids to know that they are the reason that schools exist. So if they're not getting what they need, then how do I handle this myself? And then as parents, how do you help your kid handle those situations? Because you are always your best advocate, not just in K through 12, but in college as well, and then in the workforce. So I think it's our job to teach kids how to advocate for themselves and to teach parents how many things there are out there for them to help your child be successful. It's not always just special education services, right? There are other services out there that help support students, especially social emotional learning. How do you feel? Because I know that I've had kids in my school that would make the things that they go through would make grown people sit in the corner and cry, right? And so how are we supporting those kids when they walk in our building? Because if their intent is to learn, but what's going on is preventing them from doing that, how do we support them at 8:30 in the morning when they just experienced something that no adult should have experienced, let alone a child? So I think just those approaches to social emotional well-being, to advocacy, and to ensuring that our kids understand what schools should look like. So when they don't see that, they know that they need to advocate for themselves or to bring in another adult to advocate for them.
Yeah, exactly. Ms. McCartney, I have a two-part question for you. One, what are the advantages of students to receive instruction from teachers who look like them? And are there any best practices for recruitment and retention of teachers of color? Hey, Ms. McCartney? Yeah, I think you're on mute. I'll come back to Ms. McCartney. Go ahead.
That's a good question.
Okay.
One of the advantages, I think, is to have someone that can relate to your culture that's in the classroom with you. That not only for our Black children, but for our brown children as well, is to be able to have that knowledge and that background of where these children are coming from and be able to relate to them in their academic practices as well as their social emotional practices in the classroom. One of the things as far as recruitment is concerned, we actually go to the colleges and recruit teachers. We also grow our own through Head Start has been known for years to recruit parents as teachers, start them off, send them to school, get those degrees, and work in the classrooms. One of the retentions would be offering positive training, education, and for the past several years is to address mental health with our teaching staff. I think that's very important. We look at our social and emotional growth for our children, but we have to look at what's going on with our teachers, having them available to talk to someone, to just kind of, we don't know what's going on with them when they come into the classroom. So they need that support as well.
Okay. Dr. Crook, since you are on a campus, what are some best practices that you guys use to recruit and retain teachers of color?
As a principal of an all-boys school, where we are 100%, well, probably 98% minority, there's a few things we do. One, I personally seek outside of the traditional hiring system in the school district where we're located. I often find myself sometimes just looking for talent. It's not enough just to be a person of color. I have to find talent, meaning I can't hire you as just an average reading teacher. You have to be an exceptional reading teacher. And then we process the rest, which is what other interests do you have, outside of you being a Black or Hispanic person, what else do you bring to the table? Some of that just happens a lot of times just with visits. As I meet
Mhm.
folks during the course of a meeting like this one, I may get a few emails about, hey, I'd love to learn more about your school. I'm a teacher, would love the opportunity to join you. And sort of what Dr. McCartney alluded to, often we have to kind of grow your own, I guess. We do hire a lot of young teachers to kind of start out with us, because not only are you teaching boys of color, who many come from impoverished backgrounds, you're also having to learn how males learn, and you have to teach to that particular learning modality. And so it's a lot to take in for a person who's been in education for 20 some odd years. When you just want to teach the subject, you have to kind of take on all four aspects in order to reach the boys here. And when we invest in younger teachers, what I found is that our retention is much better. And sometimes we find that folks who we've invested in them, we've taught them how to work with boys of color, some of the challenges that they may face. We've developed our own expert right here on our campus.
Dr. Shepherd, we talked about having teachers who look like the students. And we know that is not going to be the case 100% of the time. But in those cases, what are some of the cultural awarenesses that are necessary for any teacher to help Black students succeed?
Well, the first thing is we know that there are studies, and there's a study actually was conducted by some researchers at American University, University of California, Davis, and Johns Hopkins, and they looked at 100,000 children in the North Carolina area, and they even looked at some in Tennessee. And what they found was that if a Black child was exposed to at least one Black teacher, their chances of actually going to college and also taking one of the college entrance exams increased immensely. So we know representation matters. With that being said, we're not going to fill our classrooms up with people just because they look a certain way. We're going to make sure, as Dr. Crook said, that we have talent. We have the best talent in our classrooms. And the biggest way that teachers can become advocates in their classrooms is making sure that they build relationships with children. Children know when teachers care, and when teachers care, children will do anything for them. So I think the important thing is making sure that you have people who can connect with children. I can personally say that coming up as a child through Houston Independent School District, one of my most memorable teachers was a white female in 3rd grade. Why do I remember her to this day? Because I know she cared about me, and I knew every day that she cared what I learned. She cared about me as a person outside of the classroom. And so as we are looking for teachers, it's important that we're looking for those people who are going to be able to connect with the children. That's most important. And our millennials tend to have a better connection in a lot of cases with some of our younger children. However, we want to make sure that in any event, as we're hiring and as we're bringing people into our profession, that these are people who want to connect with children. These are people who can and have the capacity to connect with our children.
Absolutely, absolutely. As we are up against the time clock, I do have one final question for the entire panel, and I'll start with Dr. Campbell-Roan on this one. It's just simply, what gives you hope moving forward in education for especially our Black children? What gives you hope?
I think what gives me the most hope is that we are such a resilient group of people and we have so much grit, right? And so I know that even though we've had a setback with COVID, I think that setback was a setup for us to understand that we have to fill in the gap for our kids, and we have to do it in a fastidious manner. We have to make sure that, again, the instructional material that we're giving them is on grade level, because we know that that's the only thing that is going to help their trajectory in life if they can compete, right? And you can't compete if you don't have a level playing field. So I think that's one of the biggest pieces that COVID has taught us with this gap, is not only do we have to fill the gaps they had before COVID, but we have to fill in the gaps that they experienced during COVID. And we have a set of leaders in America that I think have a true laser-like focus on moving our kids towards success. And because of that, we're doing everything possible to fill in any potential gaps that they may have, and not just to get them on a level playing field, but provide them with additional support so that they can be even better prepared for what the world is going to offer them. I think that exposure and experience is one of the key pieces to ensuring that kids are successful. They have to see what success looks like. They have to see themselves in those positions and know that it is possible for them to get there with a little hard work, dedication, and sacrifice. So my hope is that the hope that I see is that with a group of people like this that are all in the work together to ensure that students are successful, there's no way you can stop us from getting there. We just have to make sure that the resources we have are available to the people that need them the most, and that we continue to fight for that.
Yes, thank you. Ms. McCartney, what gives you hope, especially working with the our babies?
Well, I think that especially working with our younger people is that the success is the growth that you see as they transition out to kindergarten. Not only the growth in the children, but the growth in the parents. When the parents come, they have set some goals that they want to attain also. And so if they want to get that degree, when they get ready to transition their children out, they are well on their way to achieving their degree. And I think that gives me hope, because children are not going to succeed if their parents are not succeeding. So
Right.
That's where the hope lies for me.
Thank you. I'll go to Dr. Shepherd, and then I'll end it with Dr. Crook. He'll have the final word.
I think, in the words of Dr. Campbell Roan, the resilience of this generation. This generation has been through a pandemic. They've been through all types of natural disasters. Matter of fact, I think they've been through more than any other generation has had to succumb. However, they are still standing. And so when I look at the resilience of them, and I look at how many of them have matriculated through college, and they're in college now and they're succeeding, in spite of all of those things, it gives me hope. When I look at all of our young teachers coming in, and when I look at all of us who are seasoned, who are still committed to this work, that gives me hope. When I think about just our country in general, and I think about all of the opportunities that they have and that they are seizing at this moment, that gives me hope. And so we're looking at the most resilient generation of children that we've ever seen. And so if that doesn't give us hope, then I don't know what does.
Dr. Crook?
I can tell you so many things give me hope about this generation, as Dr. Shepherd alluded to, but the practice of educating kids, what gives me probably the most hope is the fact that we've been pushed and challenged to rethink and redesign education as it was prior to the pandemic. And so we're doing things differently. We are in the classroom doing things differently. In school districts, things are being done differently. We're working in a different way, not only to fill gaps, but to ensure that we're building into children for the future and using resources that we've never had. And the beautiful part about it all is I was always taught as a principal, hope is no plan for success. You have to have a plan. So I think what we have now is a plan that works alongside of the hope that we've always had as educators working with children.
Thank you. Thank you all. Thank you to all the panelists for a great discussion. I appreciate it.
Thank you. Thank you, James. I want to also point out, as we end this discussion, 2 of the recommendations in our State of Inequities report that relate to education. The first is to increase access to quality early childhood education by supporting more low-income and working families to have access to affordable childcare, to increase wages for early childhood workforce, to increase the number of childcare providers in state care deserts. And then, as you all have mentioned about the resiliency of this particular generation of children, we also at Children at Risk are advocating that we encourage the use of elementary and secondary school emergency relief funds to increase equitable access to mental health services for our students. I thank you all so much for joining us, and I'm happy to for you guys to please review the questions in the chat, and if you have time to please help us to answer some of those. And thank you so much for your time, and we will certainly call upon you in the future.
Thank you.
Thank you.
Thank you for having us.
Thank you.
Absolutely.
Thank you.
We're going to transition into our final panel to talk about meeting the basic needs on the journey to success. If you don't have health, it's hard for you to have anything else. And learning and growing is difficult when children are faced with food, housing, and safety insecurities that infringe upon their health and well-being. This panel of experts are going to weigh in on the challenges and solution to these disparities that Black families may experience and just meeting the needs that many of us take for granted. I'm pleased to have this panel moderated by my dear friend, Leah King, who's president and CEO of the United Way of Tarrant County. She's also a member of our Children at Risk Texas Family Leadership Council and our Texas Racial Equity Collaborative. Leah is going to be joined today by Demetra Ryan, who's chairwoman of Target Hunger, by Kendra Richardson, who's the founder of Funky Town Fridge, and Felicia Jackson, who is the Family Support Services Manager of the Houston Area Urban League. Leah, are you ready?
All set, Sharon. First, just thanks so much for another amazing summit. This has been just a wealth of information. I'm looking forward to helping to moderate some additional information, which really starts with some of just the root things that we need to be thinking about for children, for families. And I'm excited for you to hear from the panelists that we have with us today. We're going to hop right in because our time goes fast. We want to be sure that we're able to hear from everybody and to get through some things that we think would be helpful for those who are participating. So I'm going to start out of the gate with a question for Felicia. And Felicia, I really want to talk to you and maybe set the stage for this panel overall about what it means to be thinking about the overall well-being for Black children and families. Would you just maybe give me a sense there on just the importance of basic needs as it relates to the overall well-being of Black children and families?
Sure. And good afternoon or good morning, everybody. I think when we start looking at what we need to do to address basic needs for our children and families, we really need to look at what we need to do now, because that actually helps meet whatever it is that they need to kind of stabilize their household, whether it's the household income or any other needs that they have. And if parents are actually struggling to try to meet those needs, then that impact or that effect is actually felt by the children. And so then that has a residual effect or impact on their performance in school, their development, and the experiences that they can actually have that actually would lead them to all of those opportunities that we talk about that we want them to thrive as adults.
Well, it sets the stage and a good foundation just for the overall discussion. And it makes me wonder, Demetra, if we can talk a little bit about just some of the services provided or addressed by Target Hunger, especially as it relates to food, housing, healthcare, and job security.
Happy to do that. And thank you for allowing me to be here today. I don't know if we reached some of these statistics. Here in Harris County, throughout Houston, about 15% of the residents are struggling to survive with just a state of chronic food insecurity. And that's higher than the state alone. Within the state, it's 13%. Nationally, on average, it's about 12%. For us, because we're a direct service provider to the community members that reside in some of the most undeserved and vulnerable parts of our city, we work to gain trust. I think some of the previous panelists talked about that. And through gaining that trust, then we have, because you can have any type of services provided, you can have the best of services available, but if the community doesn't trust you, they're not going to come out. And so it's twofold. We have to provide food to fill the basic need of hungry Houstonians, and then empowering our clients to gain independence through root cause initiatives. And so through that, Target Hunger has navigation services that we can make referrals to other housing and job training partners. And our team of navigators are equipped to help people sign up, for example, Medicaid or CHIP for their children, and to help them just find the things or basic needs they need within their home. And so things like this and collaborating with partners make a huge difference for us within Target Hunger.
Well, and a couple of things that you touched upon that I want to maybe circle back to. I would suspect that everyone on this call is very familiar
with some of the deadlines and some of the things ending as it relates to Medicaid. I wonder if you would be able to share, either you or Felicia be able to share just what those dates are and what we need to be doing to get the messaging out to ensure that people don't lose access to healthcare.
So, oh, good. So I can
I'm sorry.
actually address that because, as a matter of fact, I just was finishing up a call with someone with the state Health and Human Services this week. And so basically what is happening is the letters have actually started going out for families to actually start doing their enrollment again for their Medicaid and their CHIPs. During the pandemic, that enrollment has been waived. And so now for about 2 years, families and individuals have not had to do that. And so now the state is going back to where they have to enroll annually. And so letters have already started going out. Other letters are expected to go out by March the 31st. So that is actually that deadline. And so I have been working with some partners where we are in fear of that some of these people for this period of time, have gotten accustomed to that. And so therefore we may be looking at a deluge of individuals who may not have health insurance if they don't receive the letters or they just really don't understand what this is all about.
Yeah, and so significant issues and the opportunity for all of us who work in this area to ensure that we're doing our part to help get the message out on the timing, but also the importance of taking action so that we don't have this flood of people that lose access to coverage. And one of the things that Demetra mentioned was just talking about trust and really having that trust in the community. And Kendra, it makes me wonder a little bit about Punkytown Fridge and not only how you were able to gain the community's trust, but maybe share some of the examples of that, but even talking in the forms of social justice and what it means for food security and meeting the basic needs, and how is that a form of social justice?
So I'm actually from Stop 6. I'm from the project. So I'm from these communities that are facing food apartheid that we serve. So a lot of these people already know me. I'm used to, being in community riding in my village. So a lot of these people are probably already like aunties and uncles and cousins, especially a lot of the people that donate. And then people that come and get food. I spend time in the communities because I know I went to college and I came back home, right? So then that causes a disconnect. So I spend time at United Fort Worth, where the fridges are. Wherever there's a fridge, I'll be there, and I'm having conversations with these people or trying to impart some kind of political education as to why we're here and why we're choosing to serve the way we serve, right? And so that's a part of the social justice aspect of it all, is to depend on community, depend on trust, right? Because you don't have community without trust. So depending on the trust of the community within ourselves, so that we don't have to depend on other outside entities, but whatever we need, that there's some kind of way that we can provide it for ourselves, right? And so we do that together and we look out for each other. So it's give what you can, take what you need, not just with food, but with life, with resources, with whatever you have that you can lend to your neighbor to help them improve their quality of life, and whatever they have to give you to help you improve your quality of life, and you build from there together.
Demetra, and kind of like Kendra with being a direct service provider and really looking at people holistically, one of the things that I heard you mention was that you also work with other organizations that can help support the families that you encounter. One of the things that we hear so much about, we know is just desperately needed, is about mental health care. And I'm curious about, just from your organization's perspective, how you would see just the importance overall of mental health care and define that perhaps as a basic need. Is that something that Target Hunger is focused on, and what can we all do to help support the mental health needs of our children and families?
I'm going to connect with what Kendra just said and then move into that. It's being intentional. I like that she said, I came back to the community that I grew up in. when you're a part of different organizations, we talked about just some of the partners that are here with us today. That is being intentional and then intentionally working within these communities. The past speakers or panelists spoke about speaking the same language. So one of the things that we have in place is we have our navigators that are in place. And so with the navigators, they are all certified within Texas with the Community Care Act or Community Health Care Movement, but they also speak Spanish and then speak the language of the Black and Brown community that we work with. And so that's another important piece of it. And I think we talked about it just with our Black and Brown students. You know, there's a way that I am speaking today as a panelist, but when I'm with my family or friends, I may speak a little differently. And so again, that goes to trust, that goes to being intentional, that goes to reaching out. I can share with you specifically the navigators in collecting the data that we get through food fairs and through our clients, then are able to, again, send them to partners to assist. We are here to fulfill that basic need of food, but also to then connect our clients with the partnerships that we have. So for example, we had a family or I want to say a grandmother that was connected to Target Hunger. Her daughter actually passed away during childbirth. She passed away after giving birth to their 5th child. The husband then went through a grieving process and lost his job and needed some additional care. And so through that, Target Hunger, because of the relationship we had with the family, we're able to then address that, get him with some psychologist, some people to assist him with that, and then get him back within the workforce. So that's what our navigation services, that's what we do within our navigation services of Target Hunger.
Wow, wow. Powerful. Felicia, kind of along those lines, when you are working and you know, identifying just some of the wraparound needs that families may have, maybe you can share with us a little bit about just trends in wraparound services that that you all see, you know, either that you're doing right now, but also that you see coming in the future.
So just to give a little bit more background of the Urban League, because we actually have several different service areas. We have our workforce development and training, our housing, our health and wellness, our education and youth development, and we have a social justice center and an entrepreneurship center. And so basically we provide holistic services. So basically we refer clients within our agency and then externally to other agencies. And I'm going to say probably because our housing services area has been pretty busy, probably going back to, I think, the Great Flood during tax season. I think it was 2015. Then we had Harvey, and now we have the pandemic. And so, you know, people are really having some issues with housing and being able to have stable housing. That is something that we are seeing as of now, but then as a manager and working with our children and youth, we kind of see that as well too. You know, as the children kind of come and go, they may be at the school, you know, for this semester, next semester they're somewhere else because parents have to move because either the rent or the quality of housing, you know, is an issue. So, you know, I'm right now a big proponent, I think, in terms of health and making sure that people have health insurance, because if you're not well physically or mentally, then it's very difficult for you to even navigate your day-to-day circumstances, let alone trying to find out where you need to go to seek and get help.
Can I, Miss Leah, can I just jump in? I wanted to
Please.
add, one of the things that we also see that the population sometimes struggles with is within the high levels of food insecurity is the cultural food differences. Okay. And so understanding or getting that understanding or lack of knowledge about the proper ways to prepare unfamiliar food and overall communication challenges. And so I just want to share that's, you know, one of the things that's important within the network of what we are all doing is making sure that we're providing the things that they are familiar with so that they can then give their family the nutritional desires that they need. So I wanted to just share that also.
Thank you for sharing that. And it also makes me think about Kendra and the services that come through Funkytown Fridge and being aware of the communities that you're in, the types of foods and things like that. But I want to just also have you maybe share, we hear food deserts, and I know that you typically say food apartheid. So I would love for you to share, specifically what is it that, why that nomenclature, how you're defining it, and then perhaps it would help all of us look at things a little bit differently or more holistically, the way that you're doing with Funkytown Fridge.
Okay, so I can't remember who was saying it, but in the beginning of the panel we were talking about language and how important it is to really be intentional about the words we use and how we identify these systems that are rooted in anti-Blackness, right? And which is why we're even here doing the work we do, because we're still living under anti-Black capitalism. And so we say food apartheid instead of food deserts because we are acknowledging that these people aren't choosing to live in systemic racism or choosing to live in these neighborhoods, but they're born in them. Like me, I was born in the projects and my family had been there for 58 years before my great aunt had passed away, until I graduated high school, went to college, and then, made other decisions and choices. And so, and even though they're not there anymore, I could very well, still be there and still facing apartheid. So we are acknowledging that there are systems put in place for these people to deal with all these different marginalizations. We're not blaming those people for their own marginalization, but blaming the systems that are put in place, such as anti-Black capitalism, that is causing us to not have the access and the resources and the jobs that we need to feed ourselves and give ourselves the healthy nutrition to prevent things like diabetes and high blood pressure and heart disease and all the things that we are facing as a race of people ourselves.
And so I wanted to go back to Felicia for just one quick second too, because you also mentioned about some of the workforce development things that you all do. Can you talk a little bit about just some of the services to young people who need employment, just to be able to even support their basic needs and help support their families?
So we have a training program. Actually, our program is kind of geared towards the opportunity youth, that 16 to 24-year-old population, where they actually go through a curriculum that will give them some certification, which is credentials for jobs that are more the skilled type jobs. We've recently been doing a program where we're doing some things with some companies in reference to clean energy. And so our programs and services that we actually offer are really just geared towards making sure that people who come in our doors or within our reach, whether they're children or adults, actually have that credential that can actually get them in the door for employment.
And that's so important just in this day and time, and in the state in particular, we're so focused on energy. And so that's amazing. I was just taking a look at the clock, and just as I thought, the time is just rolling on by. But I did want to ask one question of all of you in the last couple of minutes that we have, so that we end on something that is optimistic. So this is about innovation. And I'm curious, and maybe we can start with Demetra, if you can tell us a little bit about what you're working on now that's innovative for meeting the basic needs of Black families throughout your area and the state, wherever you work.
Within Target Hunger, one of the things that we found has been working is collaborating with local clinics. So it's interesting that we spoke to the medical doctors previously, and working with them, so it's not the prescription of drug prescription so much, but more of a prescription of here's some healthy living things, here's some healthy recipes that you can be to use to help with healthcare. And so I think that's one of the things that we are working on that I think is pretty amazing. And we've incorporated more food fairs. We found that with food fairs, you can have more partners out that are available because we had about 1,400 individuals that we had to use for additional outreach services or clients that needed outreach services. So through the food fairs, we've been able to connect with more individuals within the community. So I would say those are two of the things that Target Hunger is doing now that I'm really proud of and thankful for.
Excellent. And Felicia, same question to you. What innovative things are happening at the Urban League?
So, you know, we try to stay abreast, or we stay abreast of those things that are happening nationally that then will have an impact locally to residents here. And so, of course, the COVID vaccine, we've actually infused trying to make sure that people get the vaccine, whether it's their first, second, or their booster shot, via our existing family and community engagement events that we do at elementary and middle schools throughout the Houston metro area. So we've been doing that now for the past year and a half or so. We some time back, I think in order to address the infant mortality health issue, we've actually started doing what we call virtual baby showers. And so basically what we do is we have an educational topic as a part of that, and then we infuse those fun activities that you would participate in at a baby shower. So I just kind of want to highlight maybe those two things, but you know, in addition to, there are several other things that we're actually really doing throughout other service areas as well too.
Love it, love it, love it. Oh my goodness. All right, Kendra, close us out. Tell us about innovation. Your concept overall is quite innovative. So maybe share, you know, what you're seeing right now and just the ways you're using innovation to meet the needs of our Black children and families.
Well, we do plan on opening at least 5 more fridges this year. So we're gonna start there. Every time we open a fridge, we also throw like a block party and we canvass the neighborhoods that we're going to be servicing in so that they know that a fridge will be there. So we throw a block party, we have food, and this go around we'll have bounce houses and stuff and try to get the radio station out. And we try to incorporate as many people as possible to come and bring food and have the fridge filled the first time and to come and get to know us and see us. And you know, that also opens the door for more people who want to help volunteer and clean fridges. So more fridges and block parties.
Love it, love it. Ladies, thank you so much for your time, for the information, for your energy. It's great. And we'll turn it right back over to Sharon.
Well, before I let you guys go, there is a question I would like to have Felicia address, if you will, and that's to please repeat the information from TDHHS regarding Medicare and Medicaid for one of our attendees today.
Oh, okay. So letters have actually started going out to households, letting them know that they need to renew. March the 31st is definitely when their target date to have that out to all recipients in the state of Texas, and they're looking at from March to June the 30th. For those letters to go out. So again, people just need to start looking for that stuff like right now.
Thank you so much. All of you who have participated today, this has been an incredible array of panelists. Thank you so much, Leah, for your help in moderating this particular one. And thank all of you for what you're doing for kids and families in Texas. This has been the end of a fantastic morning of information. Judging from the comments, this has been impactful and resourceful. We're looking forward to sending out to you who have attended and registered all of the links to the information that you've received today. And of course, feedback is essential to our ability to continue improving our program. So we ask you to please fill out the survey in the chat to help us out. I want to also shout out and thank our wonderful partners. Next week on February 23rd, we have a town hall discussion on immigration reform and its impact on children. You can always go to childrenatrisk.org to find out what we're up to. On March 16th, please join us for our next free learning opportunity, which is the Anti-Human Trafficking Summit. The links for all of those events are also in the chat. And as I've said so much at Children at Risk to staff and to anyone externally, equity is not just a moral imperative, but in the state of Texas, it is an economic imperative. The cost of not having basic needs met, of poor health, of poor education, unfair justice for any child in Texas means that we all incur the expenses of that. And we can't move forward as a state that likes to brag on being the biggest and best of everything if we're leaving any set of children behind. And today we're focused on the state of Black children in Texas. Thank you all for joining. Please help us improve programming by completing the survey. And I look forward to joining you all for our next impactful virtual summit. Thank you.